Let's just start with where you feel it for now.
Well, it's like right here on this part right here, and
Okay.
here. That's the worst. That's where
The worst
pain-
is here?
Like this part
Okay.
and here.
Okay.
That's where I get more pain.
How
Like,
long
it's
has it been?
there all the time. Well, it's been like 15 years.
15 years?
Yeah, I used to do I used to work for a moving company.
Okay.
And I've been doing deliveries all my life.
Okay.
So yeah, it's been there for a long time.
Did it happen when you were doing deliveries, or?
Yeah.
Was it
It
specific?
started. Yeah, 'cause I used to lift like really heavy stuff.
Okay.
So I did it for like.
Has it been getting worse over the past 15 years, or has it been the same for 15 years?
It's been the same, but sometimes it's really bad. I can't even walk.
Oh.
But sometimes it just goes away.
Okay.
But the pain is always there. But I can manage. Like something I can manage. I mean, you know.
Okay.
So I did went to a chiropractor like when the pain first started. I did went to a chiropractor, but it didn't help me at all. So after that, I didn't do anything.
Okay.
I just.
What did the chiropractor do? Do you remember? How long ago was it?
Well, it was like 15 years ago when the pain first started. So it was
Okay.
really bad. So, but they didn't do anything. All they did is they put me in a room like this. I remember that they put one of those I don't know how you call them.
Electric stim?
Yeah.
Yeah.
That's what they did. So I was there for like an hour, laying down on one of those tables.
Yeah.
They put that on my back. It didn't do anything. So.
Maybe better for like an hour. Yeah.
So after that, I said I'm just gonna stay with the pain.
Oh, well,
But then I saw your videos and I'm like, I have to try this. I have to try something because that pain has been getting worse.
Got it. Okay. What are you taking right now?
When the pain is really bad, I take some ibuprofen.
Okay.
But I try to just, take it only if it's like really bad.
Okay.
But I don't take it often.
How often does it get really bad?
I would say once a month maybe.
Okay. Once a month?
Yeah, I would say.
For the past 15 years, it's been once a month? Oh,
yeah.
Okay. Does it go down your legs at all?
Yeah, it does, yeah.
How far does it go down your legs?
All the way down. I will say it goes all the way down here, up to here. Like right now I have it on this side. Like the pain is right here and right here.
Got it.
And also here.
Are you doing anything when it happens every month for the past 15 years? Is it when you bend over? Is it when you do something at work?
No, it's just the stars. It just comes out of nowhere.
Got it. Okay.
Like I said, the pain is always there, but it's not that bad. But it gets really, really bad sometimes.
Got it. Okay. Can you tell me anything else I should be aware of?
Well, I told the nurse that I had an accident like 3 years ago.
Car accident?
No, I was playing soccer.
Okay.
And I broke my tibia on this leg.
That's a big.
Yeah.
That's hard to break your tibia.
Yeah, and it was really bad.
What's that?
It was really bad.
Wow. Okay.
But I think it's fine now. I'm able to walk and I don't feel any pain at all.
Was it at your joint of the tibia or actually straight in the middle?
Oh, it was like around, I think it was like right here.
Got it. Can I see? Okay.
And I think it was this part right here.
Mm-hmm.
And also it cracked, the bone cracked like right here.
Oh.
But I don't feel any pain now in this part.
Okay.
It was there for like a year and a half.
Okay.
So I wasn't able to walk like straight. I had like a little limp.
Okay.
But now, I don't feel any pain at all.
So let me just kind of tell you what my thoughts are really quick. So in the Gonstead work, we really look at the bottom up, right? So we look at basically, it's called the foundation principle.
Mm-hmm.
So what that means is if you're like in construction, right? The foundation is the most important thing.
Yeah.
Doesn't really matter what's going on. So the pelvis is really important for the rest of your spine, especially your sacrum. But your foot can also impact that too. So that's why it's also really important, because if you walk like lopsided all the time because you're restricted in the ankle, it can actually have a biomechanical effect all the way up into all the way up into even your neck too. So we care about that, especially because you're dropped on that side. So the reason I'm asking that is because you're dropped on that side too, right? So you see even your leg is shorter on that side too. So is it actually your leg, or is it because you broke your tibia? That's what I'm trying to figure out too. Yeah, and so that's important. And just keep in mind, this is the biomechanical reason, right? We always want to know what the cause is, but the reason why you're getting pain every month and it hurts to cough and all that, it's what we call the Valsalva maneuver. So when you hold your breath and you like strain to go to the bathroom or cough, it actually puts more pressure within your spine, right? And so you have a pressure within your spine, and you actually get more pressure as you sneeze. When you have a disc herniation that's going into the canal, then actually that would hurt even more, right? So that's why I'm asking these questions. Yeah. So it sounds like you have an unstable low back, but more so than that, it's unstable maybe in other places too. So we always want to keep going upstream, right? That's a really, really important thing for us. Of course, I want to get you relief today, but I just want to know what's going on. Okay, so this is all really good information, painting a picture. Is there anything else I should know?
Well, I've been getting some pain on my shoulders lately and my neck. But that one, it's like, I don't know, what would say, every 3 or 4 months maybe. Okay. But it comes and it just goes away like really, really fast.
Okay. That happened after you had this problem though, right?
Yeah.
It looks like that on your x-rays. Okay. Let's get started with some measurements and stuff. You know what? Actually, before I even do that, I'm just going to check your ankle before I forget. Can I have you do one thing for me? I'm just going to have you lie down on your back. Okay. So what I want you to do is actually point your toes towards your face as much as possible. Okay. And then point downwards. All the way down. Okay. And then point upwards again. Okay. Obviously this one's shorter, even on the x-ray, like this one's shorter. But just rest. So your resting one is actually what we call in like more dorsiflexion. So what dorsiflexion is pointing upwards. So resting, you're actually a little bit more dorsiflect on that one. But go ahead and point to the ceiling again on both sides. It actually looks more dorsiflexed on this side, so you actually have more range of motion on this side.
Yeah, that happens. That I noticed that after the accident.
Yeah.
That I can't do. I can't. It hurts.
That hurts.
That hurts.
Okay, and then go ahead and point all the way down for me. Okay, so as much as you can. Okay. They look even, but they're not. If we look down over here, they're not even. The planes are definitely not even. So you definitely have restriction in here. I mean, you already know because it's painful, and then you also broke it, but you still have lingering problems over there. And so basically, it's where your talus your talus is basically the anchor of your foot, and also where your tibia meet. So I'm gonna check that out in a second. This is really important for us to figure these things out. Yeah. But let me have you sit. And I'll work on that afterwards. So we got something over here that just keeps dinging. So we're looking for big spikes. So normally your you know, your skin could be different on one side than the other side in terms of heat, but it shouldn't spike just at one level, right? And so that means there's like a nerve problem, or potential nerve problem. Doesn't mean that you always have one. Okay, something right here. There. Okay. So there's this fluid over here, so we can basically see your spine right here. So it's pretty, and then right here, it's like mushy into there. When you feel a lot of pain, you feel it like on both sides pretty equally, right?
Yeah.
But then you also feel it here a lot too.
Yeah.
Let me see how bad it's affecting your calf. Can I have you just lie down back on your back? Let me know if you feel a stretching sensation or anything like that, okay? Or any discomfort.
Yeah, right there.
It is? It hurts in there? Okay. Just relax.
Yeah, right there.
Right there. Okay. Where do you feel it now?
Oh, yeah.
Where?
Like on the back.
In the back? Okay.
And here.
So it definitely is affecting your nerve.
Oh.
Yeah. So that's a nerve I'm pulling. Your nerve goes all the way to your toe. There's no muscle that goes from there all the way to your toe. Yeah. So let's have you sit back up again. Just look straight ahead. Just try to be. Okay, so you have like you can come on off. So you have like a 10-pound difference. So it's 97 there and then 87 there.
Oh, yeah? Oh, wow.
Yeah, yeah. So look at your center line.
Where's this?
Yeah. But you're still doing that too.
Oh,
So
okay.
see, this is a big problem because you lean your weight over to that ankle, right? But you have a problem like with your ankles, right already. So your balance is off to that side. You have an ankle problem, and then everything else can kind of compound. So you're kind of unstable as you just go through gravity, right? So we want to change that. Just relax here. This is your atlas. Just relax here. Good. Not too bad, right? Okay. So I'm going to be adjusting your L5, okay? But I'm going to be adjusting it so that I close off some of the swelling on this side, okay? So we got to be precise. Okay. I'm going to roll you just a little bit to me, okay? Just relax a little bit. A little bit more. Good. Okay. So just relax here. I'm going to push this in. You're going to feel a little pop here too, okay? So just ooh, good one. How was that?
Okay.
Okay. Whenever you're ready, you can come on up. Walk around a little bit for me. You can let me know if you feel anything or whatever. I just want to know.
Okay.
How does it feel on your calf right now?
Feels okay.
Okay.
Feels lighter.
Feels lighter?
Yeah.
Good. Yeah, as we close it off, the nerve releases, so yeah, that's why I want you getting some motion into there before we do anything. Yeah. I'm going to just have you lie down for me.
Okay. On my back? Or
Yep, on your back. I want to actually look at your ankle too. Okay, so just relax. I'm just going to do the same thing over on this side. How's that?
Yeah.
It's not bad?
It's not as bad now.
Good. That's higher than what you were doing before.
Yeah.
I want to look at your calf though. This is really important that I do this. So I'm going to take off your shoes.
Sure, yeah.
Okay. Painful there?
Yeah.
Yeah, this is the joint I was telling you. So this is your tibia. And that right there is your talus. And this is the joint.
Yeah, that's where it hurts.
Okay. All right, we're going to adjust this, okay? So I'm going to be as precise as I can. Okay. Okay, breathe in. Breathe out. And then we're going to pull this a little. Ooh, good. Okay. Feel that? Okay. This one I'm gonna have you scoot up for me. This one might hurt a little bit, but it shouldn't too much. Okay, so just relax. Good. Okay. And then one more distraction. So just okay. Okay. So go all the way up as much as you can. Okay. So we're getting a lot more even on that side. Okay, and then come back down. Good. Okay. Good. Okay, come on up. We're gonna have to work on that in a bit. Let me see. Okay, so this is clearing out for sure. So, all right, we're gonna leave that for the first adjustments. Where do you feel relief? I'm gonna just put some notes down.
On my back and my leg.
Good. Good.
And my head, because I had this pain for a couple of days and it's kind of going away.
The headache?
Yeah.
Oh, you have nerve pressure over there. Was the headache kind of more in the back of your head?
Yeah.
Yeah, that helps a lot. So releasing that, your headaches should get better. Do you typically get headaches?
Not often.
Oh, okay.
But I had this one for like, I don't know, a couple of weeks.
Oh, a couple of weeks headache?
Yeah.
Okay. Well, that should help. I'm glad it's going away, man.
Yeah,
Within minutes.
I can feel the release on my head.
Yeah, no, that one will work like magic for that headache. Yeah, again, like we want to know what you feel. We'll always see what the big pertinent ones are in terms of our nerve measurements, what we feel in terms of our objective measurements, our X-rays and stuff. Yeah, and then every once in a while we're going to check how your balance is too. Okay. Yeah, because we want to get you back to center line too. Part of that is also going to be putting in like a heel lift too. I think Dr. Chris told you about that.
Yeah.
Putting a heel lift on that side as well. Yeah, because you actually do have a shorter leg on that side, by the way. I don't know if it's because of the break. I don't know if it's because of what.
Okay.
But now we have to compensate for that. Yeah, because you do have an ankle fixation, but even when you're lying there, just straight lying there, your legs are still like.
You can see it. Oh.
Yeah. So it's not just the joint;
Mhm.
it's actually the leg. That's actually So that's where sometimes it's because the arch is more collapsed on that side, and that's what I was thinking too.
Oh, okay.
But it's not that your heel is literally like this too.
Longer.
Yeah.
For sure.
So we have to compensate for that with the external lift. Yeah.
Okay.
So, but that'll be later. We have a lot of things to work
Yeah.
on. Yeah. For this one, this was good. Your nerve pain should feel a lot better from that.
Okay.
Yeah. But hopefully you let me know the same news next time. Yeah. But you have any questions for me or anything?
No, right now.
Cool.
Thank you.
Good stuff.
Thank you very much.
Yeah, my pleasure. Oh, don't thank me now. Thank me when we totally fix everything. It's good meeting you.
Okay. Nice meeting you.
Yeah.
Thank you.